so if you could just explain.
Yeah, so with your metastatic breast cancer, so it started originally in your breast and it's spread to multiple spots, okay? Most of the bulk of the disease is in the bones, so a lot of it is along the spine itself. You do have a couple of areas in the pelvis. We do know that there's a spot in your upper right arm, your right ribs, okay, and several spots in your liver as well, okay? So we've targeted at least 6 areas. So the first time that we saw you, we treated your arm, your rib, and your thoracic spine. This second time around, we're treating your neck and your pelvis and the lower part of your back as well, okay?
And how many tumors do you think there could be in my neck?
So usually they don't quantify the amount when they read the report, usually because it's innumerable, okay? So it's just too many to count.
It's too many to count.
Too many to count, okay?
Because it's just through the whole neck.
It's through the whole neck. So I would say that where your cancer is, it's in the bones and it's in the liver. The predominance of your disease, though, is along the spine. So basically from top to bottom.
So that would prevent me from doing. That's why it was hard for me to do any sports or
I would imagine there was exactly because basically the cancer that's in the bones, it affects the integrity of the bones, right? So your stability is off, it causes pain. So and there's a resultant effect on the muscles as well, right? So that's probably what was keeping
because my neck was unbearable for 3 years. Like I'm talking unbearable, and I would do everything: acupuncture, masseuse, yoga, stretching. Like everything you could imagine, I did, and Al knows how much was I complaining about my neck and shoulders.
Yeah, like, so perhaps part of that was due to
and that's got to be at least 3 years. Yeah. 3 years. So there would be just too many tumors throughout my spine, even.
That's right. So part of your treatment, so the systemic treatments that you're on, the drug therapies, they will treat your entire body.
Yes.
The radiation, because it's more localized, is really reserved for areas that are more symptomatic. So if you're starting to have more pain or other types of symptoms, we can target it with radiation. That's not a problem. We can oftentimes even retreat areas. So even if you've had radiation in the past, we can sometimes do it again.
So do you think you can do my back again, the thoracic again, because it still does hurt?
Yeah. So right now, because it's been so soon since your last one, we probably want to give it a little bit of time.
Like 2 months or 3 months?
Usually I prefer to wait about 6 months, but yeah, somewhere between 3 to 6 months is that what you're looking for at least before you want to jump in and
because that's still quite pain. I'm looking forward to the neck because my neck is constant.
Yeah, so I think you should probably notice some good improvement in the neck as well with time.
That's amazing. Thank you. I really appreciate it.
Oh, you're very welcome.
The question I have is where there's a bit of a fracture on her backbone, is there a possibility that could the bone could grow back together?
Yeah, so that's a good question. So the radiation that we give helps with the underlying cancer. It doesn't help with the mechanical pain, right? So with the broken bone, it doesn't help with that. But we do know that with the radiation, with a little bit of time, usually on a scale of months, there is some reossification of the bone. So you deposit more bone to strengthen it and maybe get rid of the mechanical element with time. Yeah.
And then, so the only way to check that would be to do an X-ray sometime in the future.
That's right. So if you do a CT or an X-ray, you might see some remineralization of the bone.
And I get my first one, I think, probably in February? Because I had it in October?
Yes. Has it already been scheduled?
No.
Okay. So at some point they will want to reschedule it for sure. Yeah.
Okay. Well, you're awesome. Thank you. The radiation's been amazing for me. I wouldn't be here. I wouldn't be walking today without radiation. I mean, honestly, it took me from someone that was bedridden to someone that's here.
Excellent.
And walking around. So thank you.
You're very welcome. Okay. So.